maybe that's why everything seems frozen. But now we are here for you. Oh yeah, so we are here for you. We'll be talking about cryopreservation and fertility. I'm also glad to be your host once again, Ruth Ogogo, and I have Dr. Ken with me today. Dr. Ken, it's amazing to have you with us today.
Yeah, frozen life, very slow.
Oh yeah.
Apologies for coming up quite late.
Yeah, well, we're deeply sorry for that. Viewers, feel free to drop your thoughts, your comments, your questions in the comment section. We'll definitely attend to them. Share this link with someone so they are also able to get the information you're about to get. Yes, we're talking about cryopreservation and fertility. So this word actually seems like a very big word. Dr. Ken, maybe you break this down a bit for us. Cryopreservation.
A cryopreservation. Some years ago, I was reading a book
Okay.
about the frozen life. What attracted me to the book was the caption, frozen life.
Okay.
And then I got a book and I started reading, and then it was all about different aspects of the human life that can be frozen, from the heart, to the liver, to the kidneys, to the sperms, to the eggs. You know, basically everything can be frozen. It wasn't too long. A whole human being was frozen,
Wow.
and then to be brought back to life when the time
It's right.
when the time is right. That's the word. So a crop preservation actually just means to freeze. To freeze and then to suspend the activity of that part of the human tissue or body or organ that has been cryopreserved or that has been frozen. So to the layman, cryopreservation means freezing, and the word cryo has actually do with cold temperature, freezing, cryo, temperature. Yeah, so that's it. So it has a lot to do with fertility.
Okay.
A lot to do with fertility.
So is it our normal refrigerator now that we use for freezing? How there are some modalities to the freezing?
No, it's not the regular refrigerator.
Okay.
If we stick to fertility related freezing, for
Yeah.
instance, they are usually the dual tanks, the
Okay.
cryo tanks.
Okay.
They are just big tanks.
Oh wow.
Well, they are in different
Sizes.
sizes, you know, filled up or to a large extent with liquid nitrogen.
Okay.
And then, and the temperature is actually below the regular freezer.
Oh
Oh, yeah.
wow. Wow.
You have temperature close to minus minus 96,
Oh wow.
yeah, or yeah, 196.
Hmm.
Yeah, so it's actually below the regular 0 degree freezing point. It's in the
Okay.
negatives,
Wow.
and that way you suspend tissues and they
Hmm.
stay for as long as you want
You
them to
want
stay.
them? Wow.
And the good thing with that is that they stay at the age
Hmm.
at which they are frozen.
Okay. Wow.
Yes, at the same metabolism at which
Hmm.
they are frozen, so they don't make progress
Okay.
until you defreeze them or you
Hmm.
thaw them.
Wow.
Mhm.
Well, so dear viewers, it sounds like this topic is a very interesting topic. So yeah, we're going to delve very deeply to know a lot more about cryopreservation, and let's see if we can freeze our lives as well. Like Dr. Ken has said, we'll get more information from Dr. Ken as we proceed. So in relation to fertility, what
Mhm.
are some of the tissues, or what are some of the things that can be frozen in relation to fertility? Yeah, since it's a day with a fertility specialist.
Oh, yeah, yeah. In relation to fertility,
Mm.
things that can be frozen are basically like three.
Okay.
Oh, should I say three? Well, let me just name them. They've been more
Okay.
than three.
Mm.
We can freeze the eggs, the
Oh
female
wow.
oocytes,
Okay.
or
Mm.
ovum,
Okay.
that can be frozen.
Okay.
The male sperms
Oh wow.
can be frozen.
Okay.
Then the embryo itself,
Okay.
that is the union between the sperm and the eggs,
Yeah.
can be frozen.
Okay.
And then the ovarian tissue.
Okay.
Yeah, you can take a chunk of the ovary
Yeah.
or a block chunk of the ovary
Okay.
containing several eggs
Yeah.
in intrafollicular form,
Oh
can be
wow.
frozen.
Okay.
Yes, then you could freeze the testicles.
Oh
Oh
Really?
yeah, or
Wow.
crunch tissues from the testicles can be
Wow.
frozen. So those are some of the things that can actually be frozen with respect to fertility.
Okay, so we'll talk about age. What's the ideal age that you would recommend a lady to freeze her eggs, or a man to freeze his sperm? Do you have a range that you say, okay, if you fall into this range, you're a good candidate for egg freezing?
So now we have to look at the reason why freezing is meant to be done.
Mm,
If we understand the reason why freezing is meant to be done, then we would be able to put an age to when it's ideal to have freezing.
yeah.
You know, cryopreservation for fertility means you're trying to freeze these tissues
Okay.
with the aim of getting pregnant using the same tissue in the
Mm,
future.
mm,
And we know that fertility is time bound. The real time fertility now is time
mm.
bound because once they are frozen, they are out of time
Yeah, because they just
because
remain
they
until
just
you're
remain until
ready.
you already use them.
Mm,
So the real time fertility is time bound. You
mm,
know, for a woman with normal genes, normal biological clock
yeah.
or chronological clock,
Yeah.
we have 35 years as the bad age.
Oh wow.
Yes, after which fertility declines very sharply.
Mm,
Then the quality of eggs, the number of eggs also depreciates. Then the
wow.
chances of getting pregnant is very low. Chance of having miscarriages is a bit high,
Mm,
and all of that. That's for a woman. So if you're
mm,
thinking of cryopreservation for a woman, for instance, you should be looking at the age below 35.
wow.
Yes, the age below 35.
Mm,
And then I'll now say that the younger a woman is below 35, the better, you know, uh, the prospect, because there won't be so much need or benefit of frozen eggs beyond that
5.
age.
Mm,
Even though, you know, the truth or reality is this: whenever a woman presents for these services, she should be counseled because it's better frozen than not frozen at all. But
yeah.
if you have the luxury of having this knowledge, the means, the funds, then and you really want to freeze, then you're better off freezing a lot much earlier than
Earlier.
35.
Mm,
We're frozen at 40 in our
wow.
facility in Alps, we're frozen at 39.
Okay.
I think the highest age we're frozen was 40, even though it seems to us at that point that we're just wasting time,
Mm,
and sometimes science is not very accurate, and
yeah.
then this lady was she kept on going, just freeze my eggs because I'm not losing anything,
Mm,
because maybe if I'm here the next year or two, you won't even find any eggs, so let's
mm,
just freeze what I have and use them when I want to use it. Let me take my chances with them.
yeah.
So we went ahead, treated, froze the eggs,
Wow.
or mysteriously, she got pregnant,
Oh wow.
delivered the baby. Got pregnant, delivered the babies, and all of that.
Wow.
So
Wow.
you can still freeze beyond 30, 35. You can freeze up to 40, or you can even freeze whatever a woman has.
Mm,
You know, she just needs to be counseled that the older she is, the lesser the prospects
prospect.
of having a very good outcome.
Mm,
When the prospects are less, it doesn't
yeah.
necessarily mean it's zero. you
Mm,
know she has some chances, so
mm,
just take the chances wherever you have it. But the same goes for the man. When a man is also advancing in age, you know gametes can be frozen,
mm,
but of course the older the man gets, the lesser the quality of the gametes. So if you
yeah.
freeze lesser quality of gametes, some may not survive freezing.
Mm,
you know the chance of of succeeding in achieving pregnancy is a little bit low.
low.
Then you still would have to freeze if you really have to freeze.
Mm,
So, but then I think it's a way of preserving fertility if you freeze these gametes and freeze them earlier on. Yeah, that's the
wow.
truth.
Okay, so and let's maybe talk a bit about embryo freezing. When do you, based on your experience, when do you counsel your clients to freeze embryos, or at what junction do you say, okay, we think you should freeze your embryos?
Yeah, when a woman produces a large number of eggs in an
Yeah.
IVF treatment cycle,
Mm,
for instance, and then you fertilize the eggs, and then she has excess, you know, she could freeze the leftover embryos,
okay.
and then she could use them later after you've
Mm,
transferred the necessary good number of embryos into the uterine cavity.
mm,
Yeah, so the excess could be frozen.
okay.
And the frozen embryos now are definitely going to be better than the embryos the woman would generate in 2 years' time, for instance,
That's
because
true.
the regular periodicity of delivering babies in this part of the world is every 2 years. You know, you want to get pregnant now, give birth to the baby, have time to take care of the baby, which is
Baby.
like a year or so,
Mm.
and then you will get pregnant in 2 years.
Mm.
So
Yeah.
the eggs now and the embryos now,
Mm.
if everything is okay, are likely going to be better quality than
Mm.
the embryos generated a year later or 2 years later. So if you're
Okay.
freezing now, you're freezing better quality embryos
Mm.
and have better prospect of getting pregnant
Mm.
than is later.
Oh, wow.
We see a lot of women make mistakes here. Now they come for an IVF treatment, for instance, and
Yeah.
they produce, imagine, 10 eggs, and then the husband has very good sperms, and then you fertilize all the eggs, and then you just have maybe like two embryo transfers, transfer
Mm.
two embryos, and then she has eight left. And
Mm.
I ask, what do I do with this? Well, a good number of them, for lack of funds,
You just
just
say,
have nothing to do with them. They just want them discarded. You
discarded.
know,
Wow.
they discard, we don't discard. They want
Mm.
them discarded. And so they lose all the embryos. When they come later with some regrets, they wish
Yeah.
they had kept
Frozen.
those embryos.
Wow.
So when a woman has excess embryos, it's good to freeze the embryos,
Mm.
to freeze the good embryos.
Wow.
When you're treating a woman, for instance, and she's having a risk of having a ovarian hyperstimulation,
Yeah.
you could just take all the eggs, fertilize and freeze all the embryos, or freeze
Oh,
all the
wow.
eggs.
Okay.
So that way she doesn't have to be stimulated next time. So the
Mm.
risk of having problems with stimulation, it's reduced, and then
Yeah.
she's safer getting pregnant
Pregnant.
when she's not stimulated.
Mm.
And then the chances of getting pregnant is a bit higher when you're not stimulated because of the hormone abnormalities
Mm.
associated with stimulation and production of large
Large
quantity of
quantity.
eggs.
Mm.
And that is why for this case, minimal stimulation, when you use low dose medication to generate
Medication.
just few eggs, is
Oh, wow.
advised.
Mm.
So, but then this is just what it is. You freeze when the people are younger and have the means to freeze.
Freeze. Okay. So, dear viewers, hope this makes a lot of sense to you. He has given us an age range. Or are
And you
there?
realize I didn't mention the age of the man.
You just said when he's getting older.
I didn't mention the age of the man.
Yeah.
Yeah, when men are 35 and above too, the
Mm.
quality of sperms drop
Wow.
drastically. Yeah.
Mm.
So we're getting to be used with that level of knowledge.
Mm.
Men used to think that we are superhuman.
Yeah.
So we also have biological and chronological clock.
Yeah.
And then the older we get, the lesser the quality of the sperms, the lesser the ability of the sperm to make pregnant and healthy babies without
Yeah. Mm.
chromosomal abnormalities. So men should also freeze sperms. But men have a longer fertility life than a
Yeah.
woman.
Women.
So they can
Mm.
freeze to a more advanced age
Yeah.
than the female.
Mm.
So I'm just being careful mentioning the age of the man.
So I actually personally think this is me just thinking that even though in this part of the world you don't have men that easily go into doing permanent family planning.
Oh, that's true. That's
Yeah.
true. That's true. That's very true. Yeah, yeah.
Yeah, so this is me just thinking that maybe, just maybe, they should consider freezing their sperm if they are considering doing that.
Yes,
Because
because they should consider freezing sperm if they're
mm.
considering. These are not in the books actually. It means your brain is working. This is not in the books. So, because we've seen a lot of men, for instance,
Mm.
like some of the European guys,
Yeah.
they have a lot of vasectomy,
Mm.
and then sometimes they find themselves in sub-Saharan Africa, and they remarried, or
Yeah.
they got a woman, and
Mm.
they want to make babies, and then they now
Yes.
tell you that they have
They've got
vasectomy,
vasectomy. Oh no.
and so they cannot ejaculate sperms. And
Mm.
now it means that they have stored up sperms in their
Yes.
epididymis, and
Yes.
when the sperms are stored for a long time, the viability of the sperms decreases,
Mm.
and then the sperms are being exposed to large um, degree for a long time of
Mm.
oxidative stress. So
Stress.
the quality of the sperms are
Mm.
lesser. So the chances of getting pregnant with
Pregnant.
extracted sperms from the
Mm.
testicles or epididymis is
It's
lesser
lesser.
than
Mm.
ejaculated sperms.
Mm.
and sometimes you don't even have it. So it's
Wow.
good for them to actually think of freezing.
And I can imagine for such a man, maybe he has 2 kids, and then now they are telling him no sperm anymore, and he's
Yeah, he
just be
want
like, I have 2 kids.
to have
Yeah.
kids now. Yeah.
So please, so this is just a counsel, yes, coming from your host, Sylvia.
So while I was talking about the female, you're just cooking up something
Oh
about the
yeah.
man. That's very tough.
Yeah, so while you're on the women's case, I'm on the men case. Okay,
Oh,
yes.
that's nice. So yes, it's a very good case to think. And sometimes you have mishaps.
Yeah.
We've seen a couple of people who've had completed their family size and have decided to do all
Yes.
kinds of family planning,
Hmm.
vasectomy and tubal ligation,
Yeah.
and all of that. Then they have an accident, for instance, and lose all the
Yes.
children. I've
Oh.
seen those. Yes, I've
Mm.
seen those. Have an
Oh
accident
no.
involving the entire family, and then you lose all
Wow.
the kids. And
Oh
where do you
my.
start from? So when you
Yeah.
have a vasectomy, in that case, it means it's problem with sperm extraction. And when the
Yes.
tubes are ligated, of course, it means you're relegated to IVF.
Mm.
So quite a number of very unfortunate reasons why sperms can be stored and embryos can be stored. When military men are going to fight wars,
Mm.
or going for peacekeeping assignments,
Yeah.
yeah, they should also store their sperms, because war is war, and
Yeah.
involves taking off lives of people
Mm.
for whatever reasons. So they should have stored up sperms, so their spouses can get pregnant later. So
So the
that's it.
career people too,
Even
this is
women
also for
women
you.
go to war. It's just that right
Mm.
now, United States is trying to stop women from being combatants,
Okay.
from going to combat.
Yeah.
So they can also store their eggs when going for combats, so that they can make babies, when they are back, because
Mm.
you don't know how long they are
Yeah,
going to be there.
exactly. Yeah.
Sometimes these peacekeeping assignments can last for a year or two, or even three
Mm.
or five, and then you don't know at what age she's going, and you don't know the level of ovarian reserve she has,
We don't even know if they'll come back alive.
or whether she will come back
Mm.
alive.
Yeah.
So I'm just trying to be a little bit kind, because I hope they
Oh,
all come back alive. But they
yes.
can freeze the sperms even while they are at combat. The females, a surrogate can get pregnant with the
Yeah,
eggs.
exactly.
Because
You know,
you don't have to get pregnant all by
yeah.
yourself.
Mm-hmm.
A surrogate can do that for you, and so everything is going on in the family while you're still away. You come back and meet a strange baby, your baby.
So, viewers, you see that there's just a lot. There's nothing to lose, really. There's
Yeah.
just a lot to gain with
So now,
cryopreservation.
an aspect actually that bothers me a
Mm.
lot is it was just over the weekend.
Okay.
um I had of someone
Okay.
who was just recently married,
Okay.
and then was diagnosed with a brain tumor,
Oh, no.
and had to go through chemotherapy.
Oh, no.
And then the person telling the story, who is related to him, may
Yeah.
just be exaggerating, but 32 courses of chemotherapy,
Wow.
maybe that wasn't correct, but
Mm.
he has to go through courses of chemotherapy. And then this chemotherapy has a way of dealing with rapidly reproducing tissues or
Yeah.
cells,
Oh,
like the
my.
sperms. you know so I quickly asked the mother, was anything done about fertility preservation?
Oh, my
She said
goodness.
no.
Oh, my
And
goodness.
so, and I wonder, how can you go through
Oh, my
cycles
goodness.
of chemotherapy without
Wow.
having your gametes preserved?
Preserved.
Now we have a lot of people living and undergoing treatment for cancer, either
Hmm.
using chemotherapy or radiotherapy, or one kind of therapy, or one
Hmm.
therapy or the other.
Yeah.
You know, it's good for the oncological surgeon or oncological physician to counsel them about fertility preservation. It doesn't matter how young they are. They may be 16 years, they may be 18 years. At this point,
Yes.
you just need to have that talk, so they can preserve their fertility, because they can undergo the cancer treatment and become sterile
Yeah. Wow.
eventually.
Oh, my.
So this category of people, I think there should be a means to help them
Yeah.
preserve their gametes,
Hmm.
so they can achieve their fertility desires later in life. Because quite a number of people have breast cancer, testicular cancer,
Hmm.
childhood cancers,
Wow. Oh,
and
my.
all kinds of
Of
cancers, that I
cancers.
can't mention. So
Wow.
those having malignancy should preserve their sperms,
Mm.
yes, before any intervention, or eggs, or even make embryos and preserve them, and
Mm.
then you can take them up later.
Wow. So you see, viewers, there's just a lot of information coming here. So if you think you feel you're not a candidate for freezing, as a matter of fact, I actually think as a young lady, if you're approaching 35 and marriage doesn't seem
Coming.
feasible, yeah, and you also would love to have your kids, come on, go ahead and visit a fertility clinic
Mhm.
like ours so you could freeze your eggs. So coming to this, how do they go about freezing? So for a lady that wants to freeze her eggs, how does she go about it?
We
Or
just
for
bring
him?
it and we freeze it. A lot of ladies actually ask these questions,
Mm,
and then when they ask the question and you give them the answer, the protocols of freezing,
involved,
they
yeah.
get scared because it involves money and all of that.
Yes.
In summary, if you want to freeze an egg or you want to freeze eggs as a lady, it's as good as going through an IVF
IVF.
treatment process. So it's the same as doing an IVF treatment.
Mm,
You evaluate the woman, see the ovarian reserve, the quantity of eggs she may be having left.
yeah.
Then you counsel her. You give all the medications for IVF in stages, and then she grow eggs. The follicles, you monitor them,
Mm,
and then when they are up to the size to retriever, you trigger them to make them mature and ready for retrieval.
mm,
Then they are retrieved in the operating room,
mm.
but it's not a surgical procedure where a human is cut
Scott.
open. It's just
Wow.
a very minimally invasive
Oh,
procedure where
wow.
you use the ultrasound as if you're scanning the woman, then you
Mm,
retrieve the eggs.
wow.
Often there's no bleeding, you
Mm,
understand, and then she'll be given some medication not to feel pain,
wow.
and then the eggs are cleaned up,
Mm,
um, analyzed for
yes.
quality, and then the good eggs are selected and
And
frozen.
frozen.
So the whole
Wow.
treatment can take between 2.5 weeks to 4 weeks.
Wow. Wow.
So,
Mm,
and it required some hospital visits. So
mm.
you don't just come and say, "Hey, doctor, take my eggs and
Eh,
freeze them." Because a lot of women have met me like that. Hey, take the
yes.
eggs and freeze them. We don't freeze. We
Mm,
don't take the eggs that way because you
wow.
can't even take eggs. You can't see them. You have to grow them,
Yeah.
retrieve them, then
Yeah.
you
And
freeze
relax.
them.
Mm,
So for the woman, it's a lot technical because it involves a lot of injections, medications,
yes.
monitoring. At some point, some level of discomfort. But
Mm,
then, when you freeze them, you may just freeze egg once, and then you can have good number of babies with them later.
yeah.
You
Mm,
know, I have a little story, to tell. I
okay.
think I've said it before. We have treated a woman before for
Okay.
IVF. She
Okay.
has multiple embryos.
Okay.
So for her first attempt, we transferred two embryos.
Okay.
She got pregnant
Mm,
and had twins.
okay.
So we had frozen four extra embryos.
Okay.
And then 2 years later, she came back after she had weaned the twins.
Yes.
And then we thawed two
Oh,
of the
wow.
embryos and transferred.
Mm.
And then she got pregnant again, another twins.
Wow.
So, but what intrigued me in the whole treatment is this: in real life,
They are all age mates.
they were conceived the same time,
Yeah,
they had
exactly.
fertilization the same time, but
Mm.
in life time
Yes.
expression,
Yes.
two are
True.
older
Then
than the
the
others by
other.
two
Oh,
years.
wow.
But then in real sense, they were conceived about the
The
same
same
time.
time. Yeah.
So that's the beauty of it. You could have these garments kept now and use them to make babies at different ages.
Ages.
I think that's one of the beauty of science for me. So that's what it takes. You can freeze the eggs or freeze the embryo. Then
Mm.
for the man, it's a lot easier.
Okay.
Yeah, a lot easier. Uh, you just ejaculate
Oh, wow.
by whatever means,
Okay.
either by masturbation, you ejaculate, or intercourse and withdrawal, you ejaculate, or um,
Use of
use of
condom.
non-spermicidal condoms,
Condoms.
you
Mm.
know, ejaculate, then you bring it's just cleaned up and frozen.
Mm.
And it could be surgically extracted.
Oh,
Yeah,
wow.
for those who cannot ejaculate for some
Mm.
reasons, like those with blocked with cut vas difference,
Mm.
and then you freeze it.
Wow.
So these are all means of
Modalities.
getting, but it's easy. It's just a 1 day thing for a man, but for a
Yeah.
woman,
It's a
2.5 weeks to
process.
4 weeks. So
Hey, women are matter, eh?
no matter plenty.
But I'm sure, this is me thinking, I'm sure the society will be very boring without women. Even as even as they say our troubles are plenty, but still I can imagine the society without
There is a
women.
song now by Shaggy,
Mm.
The Strength of a Woman. It's a very nice song. I recommend it to all women.
Oh yeah, so viewers, there's just a lot about cryopreservation, and like I would always say, freeze your eggs and thank us later. There's just a lot that you stand to benefit with freezing your eggs. So please, this is for the ladies. Please consider it like very, very urgently. Take it as a matter of urgency. If you feel, like I said, you're approaching 35 and you hope to have your kids and marriage doesn't seem feasible, please consider freezing. If you're a career lady and you want to pursue your career and it doesn't seem like you'd be finishing within your good fertile period, please consider freezing your embryos, and a lot more that Dr. Ken has mentioned. It's been,
In the science of aging,
yeah.
I thought you asked me this question, but since you didn't ask, I'll ask myself the question and
Okay.
I'll answer it.
Yeah.
You would have been wondering,
Mm,
why don't the eggs or sperms frozen age?
mm,
Why don't they age? Why do they stay 20? For instance, if you freeze an egg at age of 20,
yeah.
when a woman is 20,
Yeah.
and then she uses it at 40, the
Mm,
eggs are at
still the same.
20.
Mm,
What happened? The reason is this. That is why we age. Our body undergoes metabolism,
yes.
and then some of us have cells that are rapidly multiplying, producing, and all of that. And then as the cells are rapidly metabolizing,
Yeah.
the cells is deteriorating,
Mm,
it's aging,
mm,
and then people die. That is
mm,
why people die actually,
mm.
because they're
Quality of life.
rapidly, yeah. I know
It's
that is why animals that are slow, for instance, that are not very active, live very long.
okay.
Yes, an animal with cells that are not rapidly multiplying
Yeah.
and dividing live longer.
Wow.
So when you freeze these gametes, you stop the rapid multiplication of cells, rapid
Mm,
cell divisions, and all of that.
yeah.
So you stop the metabolism,
Wow.
and so they stay suspended as long as you keep them. And
Mm,
that is why you could see that just last year or 2 years ago, embryo that was frozen for about 30 years
yeah.
was used to get pregnant.
Wow.
Frozen for 30 years,
Mm,
got pregnant after 31 years of freezing. I mean, delivered at
wow.
31 years of freezing.
Wow.
So
Wow.
all the cells are suspended, so you don't get old. And
Yeah.
that is why even this young girl at 14 that was frozen in the
Frozen.
United Kingdom.
Wow.
Yes. So, and hoping for when the treatment for her kind of cancer will
Oh,
be gotten, then she will
no.
be thawed, brought back to life, and
Wow.
cured. So
Wow.
whenever she is thawed and
Yeah.
brought back to life, she'll still be 14.
Okay.
And then those of us who are still living in the real time, you
Yes.
know, will probably have advanced with 10 years if she was frozen for 10 years. So,
Yes.
and all of that. So this is what happens. When you freeze them, they stay suspended in
Mm.
development.
Wow.
No metabolism is going on, no cell division is going on, so they just stay arrested. So
Wow.
when you unfreeze them, life begins again.
Again. Okay.
So
Wow.
that's the science behind it. And that is
So,
why we age, and that is why we do not age.
so viewers, I hope you really understood this science that Dr. Ken has just explained for us. Dr. Ken, it's really been so wonderful having you with us
Thank
today,
you.
and I really had a very good time on this
Yes,
chat.
and real apologies to all those who waited, and we started a little very late.
Yeah.
So apologies, and we hope to start in good time next time.
Yeah, I'm
So
sure
sorry about
since
that.
our next topic will not be cryopreservation, I believe that we will not be frozen. I'm so sorry. Will be delivered to you in good time. Thank you so much, dear viewers, for staying tuned. Thank you once again, Dr. Ken, for being with us today. This will be the much that we'll do today. Have a lovely evening. Bye.